Hey there, it's Claire from Clairified Creations. Good morning and welcome to a work day in my life / productive try and get some things done day. This is my first official day off of orientation. So I had orientation at my job for 8 weeks. I'm an oncology nurse and this is day one of officially being on my own. So you might be wondering if I'm feeling a little bit nervous because I'm not paired with anybody anymore. I want to put kind of like an asterisk to that because last week I felt like I was sort of on my own. I wasn't. I had someone there pretty much at all times, but I was kind of running everything. So I'm thankfully not that stressed going into work today, which I thought I would be. So that is a huge blessing to feel okay about things. I know that I'm still learning, you guys. Sometimes I really just don't know what to do when the patients call and they ask me something or the appropriate person to get that call to. So that has been really the biggest challenge so far. I have learned procedures. We do a lot of brachytherapy procedures and I'm actually feeling really good about how those run. I got a lot of experience doing what's called tandem in rings last week. And that was good to just kind of put all together and know the process for that. Today is not going to be a procedure day. It's going to be more of a triage. I also have a meeting in the morning where we all get together, different people from the department, and we talk about the nurse schedule. So we'll probably mention IVs, who needs them, because one of our jobs is to insert IVs for IV contrast, which is for their CT simulation for their radiation treatment. So I have been getting a fair amount of practice with starting IVs, which has been really good. And the beginning of this, I used to feel so nervous about starting an IV just because I hadn't done it since really nursing school super consistently. At my previous job, we did not start any IVs. We only did blood work, which is similar, but it's a little bit different. The process for an IV, you know, have to flush it, make sure you got blood return. So it's been interesting for sure. You definitely learn who has great veins and who doesn't real fast. So that's kind of the rundown for the plan for the day. After my meeting, it's straight in the morning. I will go back to the nurses station and kind of help out with rooming and any phone calls. Sometimes there's some voicemail messages for nurses and I'll call those patients back. A lot of them just have questions about treatment because they are on radiation treatment / possibly chemo, and they want to know, is this normal or when should I come in for this? So I'll triage that, answer any messages that are sent to me or any of the nurses. My last big thing probably for today is to run to the sterile processing place and pick up instruments for tomorrow because we have 2 procedures tomorrow, and between procedures all of our instruments that are internally inserted, forceps and scissors, those are sterilized too. That's pretty much it. I also have to leave a little bit early. I'm leaving at 1:45 today. It's kind of nice to ease into the Monday leaving early. Not gonna lie, I really like the fact that I'm not gonna stay there all day because last weekend, so yesterday and the day before, we were in Tennessee, and on those weekends, I love spending time with my family and being there, but I really don't get anything done that I need to over here. So after my doctor's appointment, I'm planning to go grocery shopping, maybe try and set some more things up in the apartment because you guys, I still don't have anything really on the walls. It's been over exactly a month today since I've lived here. Alright guys, I am in the parking lot right now. I know, such exciting news. And I'm gonna wait here for a little bit. I always get here way too early. Sometimes I get here 30 minutes early, and that is the case this morning. I did think I was gonna stop and get gas because I was not being responsible yesterday and did not get gas. I had 1/4 of a tank, and then I saw one gas station was $2.57 and I was gonna go to one on the same side of the road as me. It was $2.87. I thought, well, Guess I'm getting it after work because I don't want to pay $287 if I don't have to. I will just try and update you as much as possible. Lunch is going to be provided for us because we're going to get free lunch from a caterer. I'm not sure which one, but I'll take anything free. So I did not have to pack a lunch. Hey guys, I have not updated you since this morning. I am done with work. This is crazy delight. They catered Olive Garden for lunch. I really did not eat lunch or take lunch. I just grabbed a bite of the lasagna and a breadstick and headed back out to the floor because I was leaving early. And I'm at my appointment now, so I'm gonna go in, and afterwards we're gonna do all the things, go shopping, go to CVS and pick up a print that needs to be reprinted. If you've seen my last vlog, that you know one of the prints that I got for my apartment to hang up was cut off a little bit, so I'm gonna go pick that new poster up, and fingers crossed that it all looks good. Okay, you guys, I got the poster print and we're gonna see what it looks like together. This was the end of it that was cut off in the last one. I will show you all exactly what it looks like when I get home. I'm trying to beat rush hour traffic, and I only have really a few minutes to go to the grocery store, and I know I'm gonna hit rush hour, but trying not to as much as possible. Let's go to Walmart, our last and final stop before going home. I've already stopped my appointment, the gas station, Target, CVS, and now fifth stop. The chicken pasta bake, and this is the end result. Looking good. Okay guys, it is 9:25. My boyfriend just left about 15 minutes ago or so. He normally doesn't stay that long, but we ended up watching the first episode of a new show, and I kind of got dinner started late. The show is called Severance. Comment down below if you all have seen it. I think it's an Apple TV only type thing. You have to get a subscription if you want to watch more than that. I might get the free trial because it was very interesting. I've never really seen a show quite like that. The only thing is, anybody that knows me knows that I'm not very bright with shows in terms of thinking a lot. I don't really get common sense things when a show is obvious. I'm the last person to know. People are often thinking, why did you not pick up on that sooner? We'll see if I end up understanding the show. I'm just putting this poster print in here, and it fits good, okay? Everything is looking really good so far. Let's see, what other updates do I have for you all? I just kind of wanted to chat on here because I feel like it's been a really long time. I've continuously made excuses on why I'm not filming, but I'm gonna film. Work was good today. I don't know if I said that. It wasn't too bad. I had some triaging that was kind of crazy. A lot of questions, a lot of procedure-based things. A lot of cancer patients have surgeries, and then family members call wanting to know if their treatment is still good with surgery, how long do they have to wait after surgery, and I'm still learning a lot of that. And there's this one, it was a bit of a disaster. Updates on tomorrow. Tomorrow is a procedure day, and that'll be good but busy. We have potentially 2 procedures tomorrow. Both of them are tandem and rings, which is known as brachytherapy. And that's kind of what my role will be, is getting their vitals, setting them up, changing out the fluids if needed. It's very one-on-one nursing, and you get to know these patients super well because you spend the majority of the day with them. Their first treatment usually is kind of an all-day thing because there's a lot of planning that goes into radiation. I might make a whole separate video on brachytherapy. If you all want to know all about brachytherapy, comment down below. I think it would be very helpful. It's just a lot to discuss, and it's kind of graphic, to be honest. Brachytherapy is not something super pleasant. It's crazy what these people have to go through. But if you all want to know all about that, I might make a video on it. See, this is what it looks like. Yay! It looks so good, you guys. Way better now that the words aren't cut off. I'm so excited to have these put up on here. I went grocery shopping. I should have done a haul for you all, but I kind of forgot because I was in a time crunch for dinner. I didn't get a ton, but kind of a lot. I spent $76. How do you go to the grocery store and spend $76 and only get one rotisserie chicken and no meat? That's just bizarre to me that food is that expensive. Anyways, I think I'm gonna go ahead and go to bed and get ready for tomorrow, just kind of recharge. I'm gonna do maybe a morning routine and a night routine of what this nurse does every morning and night. It's been such a learning curve, but overall I feel really good about my decision in moving here. I know a lot of people were kind of questioning it. It was very unsure because I've never done anything like this before, but it's starting to feel more like home. Tennessee, I think, will always be my home because I've lived there for so long and I just love the people there. My whole family is there and none of my family is here, unfortunately. It's been good. It's been good to learn and grow a lot. I forgot, before I close it out, I wanted to show you all my new notebook I got from Target, and I'm planning to put all of my notes that I have just compiled on different notebook paper and random sheets of my work. I've been taking notes as I go along about different types of cancer, treatments. I got this really cute notebook and it was $3, which is awesome. Has like a little pink design inside. I thought it was a good deal. Tomorrow, if I'm not too crazy busy, kind of when I have a break, I'm gonna try and copy everything onto here just so I have it all in one place and can look back on it and write things down as I need to. That's kind of a tip I have in nursing that I have found helps me so much. If I don't write it down, I feel like I'm always bugging people with the same thing because I don't remember what they tell me or how do I get this spot in the chart, because this whole charting system is completely new to me as well. It is not the same as Tennessee. I'm learning a new charting system, learning a new job, new role, and it's been a lot, and thank goodness I've been taking notes so I can just look back on notes and it tells me step by step. It's like your own cheat sheet to working as a nurse. So if you all haven't done this before, even with school or clinicals or how to do things, highly recommend getting a notebook, having it all in one place. I should have done this earlier, but I didn't, and that's okay. I'll see you sometime soon. If you like this video, definitely subscribe for some more content. Bye.